You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people that are suffering with sleep apnea. And for those of you that have been told you have to wear a CPAP and you just refuse to wear it, Dr. Sofferman says he has good news for you. Also, headache sufferers. He is helping people every single day get off their medications in certain cases and be headache-free. With us, we have Dr. Sofferman. Dr. Sofferman?
It's a pleasure to be here. Thank you.
Now, lots of questions. This is a big topic. And we're going to talk in the first half about the sleep apnea, the second half about the migraine, what you're doing for headaches. For people that don't know your practice, I guess you have a general practice.
Yes.
But you also focus on sleep apnea and migraines. Tell us about it.
We have a general practice, which we see children and adults, family general practice. We do cleanings, bleaching. We do crowns. We have a CEREC machine, which cuts crowns in one visit, so you don't have to have temporaries anymore or messy impressions. We do extractions. We do dentures. But my focus is on sleep apnea and headaches.
We've talked on the phone. You say you see transformations every single day in your practice. Right. Every week.
Every week.
What do you mean by that, transformations?
People who woke up with headaches, people who felt lousy in the morning feel better. People who had no energy have energy. People who couldn't get off to work are getting to work. People who at nighttime just wanted to be in their room and hide under a cover are back playing with their families and their children. We see people who are back in bed with their bed partners after 3-4 years of sleeping in separate rooms because of the loud snoring. We see people who can wake up in the morning and go to the gym instead of wondering how they're going to make it through the day because they have no energy to start their day, and they even have trouble possibly getting dressed. They're not clear-eyed, they can't focus, and we see a huge difference, whether it's a child or an adult. We see it across the board.
Now, and we've had conversations over the telephone in prepping for this, but sleep apnea, I guess these people breathe perfectly all day long, right? They're okay breathers.
They're
and then
okay
they lay
breathers.
Down and now they can't breathe.
Yes.
So their jaw is what? Floating back?
Well, it's all different, their jaw's floating back, their tongue could be large, their neck muscles, sometimes, right now, one of the top subjects is that if your neck size is too large, you can almost pick out an apneic just by their neck because the pharyngeal muscles weaken. It's all a matter of air getting down. When you breathe it in, it could be that the tongue is so large and when it goes back, it blocks the airway so that the air cannot get down the rest of the body. It could be that the neck muscles are so flabby or their neck is so big that it makes a constriction so the air doesn't go down. It's really...
So as a dentist, you're what? Making an appliance that brings the jaw forward?
As a dentist, we make an appliance, we bring the jaw forward. Sometimes we can bring the tongue forward. And hopefully, which happens a lot of the times, they get better with the appliance. Randy, there's so many people being told that they have to wear the CPAP machine. But the studies show after a couple of months, sometimes even a couple of weeks, they just put it under their bed, it's in their closet, and they're not wearing their machine. And they still have the symptoms, and they're still snoring loud, and they're still waking up their wife, and they're still not getting the proper night's sleep. They wake up in the morning tired. Could you imagine waking up in the morning tired to start your day? People have to go to work. Some people want to work out. They can't.
Yeah, if you don't sleep, you feel lousy.
You feel lousy. And some of them also waking up with headaches because the carbon dioxide's just staying in their brain. It's not being blown away all night. So they wake up tired. Their organs aren't getting replenished with nutrients because they don't have the oxygen going into their body. By 2, 3 in the afternoon, these people need coffee after coffee or those caffeine shakes. And by 4 or 5, they're done. I have patients, they come in, they say, Doc, 5 o'clock, 4 o'clock, I really can't drive home today. I have my buddy drive me home. I'm afraid I'm going to fall asleep at the wheel. And it's scary.
So these people, by the way, they think they're sleeping, and they're not.
They think they're sleeping, and they're not. What happens is, all apnea is a cessation of breath for more than 10 seconds. It's not all it is. It's serious. So you stop breathing, Randy, for 10 seconds now, and let me know how you feel. This happens sometimes to people 30, 40 times in an hour.
Okay.
And it's serious because the body never gets a chance to rest. So what happens is the brain will wake that person up after they stop breathing, and then they'll gasp for air. If the brain didn't wake you up, you're going to pass.
All right. So the appliance you make does what?
The appliance we make will bring their jaw forward, will hopefully have them breathe better at night, so air will get in and they'll feel better in the morning. What happens when usually patients come in and they say, you know, the first sign that I know the appliance is working is, I don't feel as foggy, doc. The fog's gone away. In the morning, I feel refreshed. I have energy. You know, some patients, 4 o'clock comes, they don't need someone driving them home. They get out of work, they can go home and play with their kids and have dinner with their kids. That, you know, when you don't have energy, you get depressed. When you get depressed, you're an MD, not knowingly may put you on antidepressant. That can make the situation worse. It becomes a cycle. And, you know, unfortunately in our society, we have this cycle going on a lot.
Okay. I mean, you have medical doctors that refer you patients that I guess don't want to wear this CPAP breathing machine. Is that right?
Yes.
Like who refers you patients?
I have pulmonologists refer patients, medical doctors refer patients, and we get a tremendous amount of patients from other patients because they're CPAP groups. I mean, we just had a state trooper in. This guy was built like a brick, and he was so afraid around 4 or 5 o'clock he had to go off patrol. And he goes undercover a lot. He didn't even know until his buddy told him that this appliance exists. We got him into the office, we made him in the appliance. Within a week, he's back on the beat, feeling great. And it's wonderful.
Or for some people, this is like a bit of a miracle. That means they go from feeling lousy because they think they're sleeping, they're not really sleeping. You open up their airway.
It's a total miracle. It's a new lease on life. And really what we're doing is we're just getting air down into their body. You know, I describe it a lot to patients. Just picture you have this beautiful kitchen, because I don't want patients to think that they're not healthy. There's nothing wrong with their organs, no wrong with their heart, wrong with their lungs. The problem is like you have a new kitchen, but guess what? The washing machine can't work that well. It starts shaking. Your dishwasher's not working that well. Do you know why? Because the plumbing isn't allowing the water to get through. Once that water gets through and it gets enough water for the dishwasher to work, enough water for the washing machine to work, it works. That's just what it is. There's not enough air getting through at night. These people stop breathing. And every time you stop breathing, you're really not getting your good restorative sleep. And you really don't feel well when you wake up in the morning that way.
Do you have any proof? I mean, in my limited research, that you go and you do a sleep study, and they give you these numbers, and then after the CPAP or whatever, they give you these numbers and they improve. Do you have the same type of studies when it comes to appliance therapy?
Absolutely. Of course we have those studies. What we do is, as soon as we get them to a point where we feel that appliance is at its maximum position, we send them for another sleep study and see where we're at.
And what does it look like?
Usually they're great. But subjectively, too, when a patient tells you, I don't have my headaches in the morning, they're gone. I have energy. I'm back at the gym. I'm lifting weights. I'm working out. I have my life back. I have my kids back. I got my wife back. In more ways than one do they have their wives back. Because now, not only do they have to get home and be tired and have dinner with their wives, what about at night? Some of these people are in separate rooms. Could you imagine sleeping in a separate room from your wife for the last 5 years because you made too much noise, snoring? And they feel...
Is there a lot of that going on?
There's a lot of that going on.
Really?
Yes. Matter of fact, there's a woman, 2 women, just came to me, different parts of the state. Both of them had the unfortunate situation where their spouses passed away. And they were both redating. One was in their 70s and one was in their 60s. Both know they snored because they were telling me the last few years that they were with their husbands, they slept in separate rooms. But now they want to go out on dates again. And then one of them has met a man. She doesn't want to snore. So we made her an appliance. We had both of them had sleep studies. We made the other lady an appliance. And guess what? They're back in the world. They're dating again. You know what? 60s today is like 40s, like 40s. When people are 60, 70 years old today, it's like being 30, 40, and 50 years old back when I was born.
Well, logically, it makes sense. I mean, if you breathe okay during the day, you lay down, your airway, that there's, your mouth or your jaw has something to do with it. It seems like everybody would know this. So why because you say all these people are their only option oftentimes is that CPAP machine.
Yes. Their only option is their CPAP machine, and it's just not out there enough with the...
they don't even know about the appliance therapy?
Some people don't even know about the appliance. Hard to believe. That's why I love to talk to people. I love to talk to groups. I love to tell people about it because it will save a life. It's just fabulous. And the rewards are, you feel so good because you've given someone their life back. And this is what they tell me. It's not like I'm telling you this. Okay. I mean, I'll have patient come in, they'll give me a hug and a kiss and say, God, doctor. Matter of fact, sometimes it gets scary. I had a guy that drove motorcycle. He came in with all his tattoos. He's with one of the groups, he has, and he had sleep apnea, and he didn't want anyone to know in the group. He didn't want his wife to know that he was getting this appliance because to him he felt like, you know what, it's my business. I mean, he came in, and I said to him, please don't kiss me. We all laughed, but he was so happy. I mean, he gave me the biggest handshake you'll ever imagine and said, anytime I want to go out with him on the road, let him know. He has so much more energy that he's back on his motorcycle. He wakes up in the morning, he doesn't have headaches. He's back on his bicycle. He's able to go to work on his bike. He's able to do his job. He's able to function. I mean, that's what people need. People need to know. I mean, when you wake up in the morning and you're tired, I don't think there's anything worse because that could lead you to be depressed. Because, I mean, look, our lives, we're moving at 100 miles an hour these days. The economy, everything's changed. People are working not one job, people are working 2 jobs, and they know who's out there, and especially women. Women come into me, it makes me feel horrible. I see a woman who's got to go to work, but before she goes to work, she's got to get the kids off to school, she's got to make breakfast, she's got to get home, she's got to have dinner on the table. How do you do that when you wake up tired in the morning?
So women also get sleep apnea?
Oh, absolutely.
Common?
Common.
Interesting. And so this CPAP, by the way, and I know that you came on the program, you didn't want to badmouth CPAP because it works.
It works.
Right? But I think your point, and I don't want to put words in your mouth, is not everybody wants, I mean, some people refuse to wear it. So is that who this is for?
This is for the people who refuse to wear it. This is for the business people who have to wear it, and you don't want them to go off it. They don't want to go off it, but then they're going through an airport. Then what do? That's a big, very cumbersome machine to take through airport. This is for people that maybe want to go away for a weekend and they're with their friends and they don't want everyone to know that they have the machine. So there's also
a simple appliance.
Simple appliance.
And they can breathe again.
Yes, you can breathe again.
Interesting. So the CPAP, which is like the gold standard.
That's the gold standard because you've got that air shooting down. An appliance will never be a CPAP, but aren't you better getting 80% results than no results?
Now, some people, by the way, is it complete like a complete reversal? Like somebody that couldn't sleep at all? Or somebody that had, they were loud, snoring loudly, and their whole family could hear them? Do you ever get anybody that all of a sudden, maybe their spouse says, there's no noise when he sleeps?
All the time, every day. Like we're failing. The first day or two, after I put an appliance in, the snoring's gone. But that's great.
Is the snoring the easiest part to get rid of?
That's easy.
Really?
That's easy.
Because the wife or the spouse or the partner, they're the ones that are exhausted too, right? Because they're kept
And that's
up.
when you got to be careful. I tell my patients, you know what, you stop snoring, but we still need a sleep study because you could be a silent apneic. Just because you stop snoring, it doesn't mean that you don't have apnea because you remember those muscles in your neck could still be tight and you still may not be getting the proper amount of air that your body may need, though you stop snoring and feel a little better. And then we could move the appliance around.
So you have to adjust it.
We adjust
like some
it,
people need.
Yes.
And they're comfortable with it?
Yes.
They get used to
absolutely. That's what brought me to do, when I first started in sleep about 20 years ago, I would say to myself, gee, how can this appliance, you bring in the person forward, it's got to affect their joint, it's got to affect, and it really is really good for a patient most of the time, because even when someone has a joint problem, we usually bring them forward when we make them an appliance for a headache and a joint problem. So it goes hand in hand. Matter of fact, I just had an intern in from Yale, and she had undiagnosed sleep apnea. She was getting headaches. Every day she woke up, she was having trouble in her internship. We did a quick sleep study on her, sent her right to a Yale pulmonologist, who I happen to know refers to me. And before you know it, we made her an appliance. She said she's able now to do her 12, 14 hours in her residency.
So she was sleeping. I mean, she was not sleeping.
No,
because
she
of her
was
sleep
not
apnea.
sleeping.
Are the single ones, the people that sleep alone, are they the ones that it's tough on them because nobody's telling them how loud they are?
I guess it could be.
Because if you have a partner, they're going to tell you you're loud.
They'll tell you you're loud, yes. But at the same time, people know when they wake up, and you just wake up feeling tired. You wake up with a headache. You wake up with a lack of energy. You know, when you wake up in the morning, I don't think there could be any, for me, I empathize with them so badly, because when I wake up, I feel like, boy, my day is starting. I'm so grateful to God. I'm so grateful for life. And then somebody wakes up and they're just tired. That is sad. And that's why I got so into this, because it's so easy to change someone's life with just a basic, simple appliance.
So, you know, going into this interview, it's very interesting, because going into this, I'm thinking it's just about loud snoring and now taking it away. But it's more than that. It's these loud snorers are also not getting their sleep.
Absolutely.
So they're tired, and you fix it, now they have energy.
And just remember, too, not everyone that snores has sleep apnea. You know, medically, you could just have a uvula that's just vibrating, and you could be fine. It's not the case a lot of times, but not every snorer has sleep apnea.
But are the snorers easiest to take care of?
Snoring is easy to take care of. Easy.
Well, spouses or partners that are watching this need to drag their partner in to get this done?
Absolutely.
So the snoring goes away.
The snoring goes away.
But the apnea is a different story.
It could go away fast, but you know, we have to make sure the apnea goes away, because like I said, you could develop a silent apnea. Just because you stop the snoring, it doesn't mean that they're getting the proper amount of air down. And it doesn't mean that that cessation of breath for 10 seconds is stopping.
So you've studied this for 10 years. You teach it at the university.
For 15, I'd say 15 years of sleep.
You teach other dentists from all over the world, is that right?
Yes.
At the university on how to do this?
Yes, yes. And
are they skeptical at the beginning?
No, because they come to us from all over the world because they know how great the department is. We have probably one of the best departments. And remember, I trained in this department. They trained me.
Okay.
And I went back to school on and off for like 6, 7 years to get the complete picture so I could do total care on a patient from the neck up.
Okay, so we're talking a lot about sleep apnea, and we're rushed for time here. But there are people that come to you because they're really loud snorers, right?
Yes.
And you're able to take care of that.
Well, we're able to take care of the
But you
snore.
said that another side effect happens. Then all of a sudden their headaches go away. Elaborate on that.
Well, a lot of people who have sleep apnea get headaches 4 to 6 times a week because there's a lack of carbon dioxide being blown off, so the CO2 stays in their brain. So that immediately goes away too. They feel less foggy. They feel like they're clearer immediately. This could be, I'm telling you, by the second night, the third night. And if it takes a week, it's a week. But I'm tenacious. I don't stop. Okay. And you know what? We don't just make one appliance. There's different appliances for different people. And
we're talking about appliances that go in their mouth, that bring their jaw forward,
yes.
So that way when they sleep, they breathe again.
But we have very thin women who maybe couldn't wear an appliance where it would impinge on their cheeks. We have very heavy men who possibly don't want to have an appliance where they're locked, where their upper and lower jaw are locked in, because some appliances lock you in, some appliances give you that full mobility, but at the same time, they grind at night. So it's just not, let's put the appliance in. That's what I think, that's why going back to school really helped me.
So there's a lot of technique to this. The appliance
technique.
Doesn't do all the work.
No.
Because it seems easy to me. I guess you make it sound easy. Right?
You know what, compared to people who suffer from headaches, sleep apnea, it is easy, especially when you know what you're doing with it.
So wiping out sleep apnea where you are, so you want to wipe out sleep apnea?
I would love to get the word out that if people can't wear their CPAP, if they're unhappy with their CPAP, or if they know they're snoring and they wake up tired, they wake up miserable, to get a study or to get an appliance if they have sleep apnea. It could really help them.
So are there a lot of guys, okay, that they know they're really loud, they've already accepted sleeping in the other room of the house, that they think it's just a bad snoring problem? They don't realize that they could be feeling so much better if they got this program.
Absolutely. Yes, and snoring is just
so snoring is not the least of their worries. It's really that they're not sleeping.
Yes, they're not getting
Is
sleep.
that right? Are the patients ever frustrated? Like they're going, how come nobody else told me this?
You know, we get that all the time. Matter of fact, that state trooper that came in, and then there was another nurse that came in. Nurse, I'll give you a better one. Doctor, MD. I was at his office with my mother-in-law, and I said, Jesus, what's going on with you? I mean, I knew he had sleep apnea. I said, are you wearing your CPAP machine? He goes, no. I said, what's the matter? Get into the office. He says, I know, I meant to call you. I'm so busy. This is one of the top doctors in our area. So we made him a custom-made appliance. He feels so good. He's got more energy than he's ever had. And you know, it's great because he's putting the word out there now. We're getting more of his patients coming in, and we're helping more people. That's what life's about, helping people.
We are out of time on this segment. We're going to talk more about what you're doing for people that have headaches. And you say that every single day you have people that have headaches maybe 10, 20 times a month, and now they're gone.
Every day.
Is that right?
We treat people with headaches with all shapes and sizes, all age groups, from as young as 6 to as old as 80 with headaches.
Now you've done a specialized training in what?
I did a fellowship in oral facial pain, and I'm a diplomat of the American Academy of Oral Facial Pain, and I teach at Rutgers fellows from United States and all over the world, sleep apnea, oral facial pain, temporomandibular joint dysfunction, and any problems that we see with patients that have pain from the neck up.
So there are people that have had headaches for years, 10, 20 years?
There are people, unfortunately,
that
have not gotten rid of their headaches in many, many years. And sometimes it even gets worse because then they go on medicines, and that makes their headaches even worse. Because
you treat those people?
We treat those people.
What kind of results?
We have great results. You know, it all started, this quest started because my daughter, I saw my beautiful daughter suffering with headaches at a very young age and wasn't able to participate in sports, not able to really reach her goals at school, couldn't participate in after-school activities. I mean, it's hard, Randy, when you see your daughter in the morning and she's got a blanket over her head because the light was bothering her. And so I went on a quest to help people, in particular my daughter, get rid of her headaches. And it took quite a long time for me to learn what to do, but thank God she's headache-free, and thousands of my patients are headache-free.
Who is the typical patient that comes in for headaches? Are they in their 40s, 50s, mostly women?
My headache patients all over the board. It could be a 40-year-old woman. It could be a 6-year-old child who just recently, a 6-year-old child could not even get out of her bed. Similar to my daughter, she said she has a knife in her head every morning. Then I have the 45-year-old teacher who, as soon as class ends, she said all she would do was close the door, go home, close the door. She couldn't deal with her 4 children or her husband. She just had nothing left because the pain, it keeps building up on some of these people all day long. Could you imagine walking around in pain all day? You wake up in pain and you have pain all day. It seems terrible. Sometimes the solution could be as easy as possibly a muscle. Sometimes it could be very complex. But I try to be relentless, and I try to work with the patient. I don't really care how many visits it takes or how much I have to do. I want to get an answer, and I want that patient pain-free.
Now, you have mentioned, and we have about a minute left, that it's not just one thing you're doing. But as a dentist, this part of it, the way the teeth are coming together, if you could give me a simple answer of how does the bite or the way the teeth come together have anything to do with a headache?
Well, sometimes at night when people are grinding and they're teeth are found in a malocclused position all night long, they wake up in the morning with a headache, and that could kick off a headache. Just take your finger and take your thumb and keep your finger tight, your hand tight, all night long. If your hand was tight, this muscle right here would be very, very hard to open up your hand.
Interesting.
Now you have these muscles that are in your head and by your brain. So instead of maybe pain radiating down your hand after a night of holding your hand like this, picture if your teeth were locked together for a whole night. You have all your nerves, your brain is right where your teeth are, right?
And so for some people, all you do is relax their jaw or get them comfortable.
Yes.
And their headaches go away.
Yes, and their headaches can go away.
But some people, what if you're not a grinder? Or do you have to be a grinder for the connection to happen with the
You don't have to be a grinder, but some people don't know that they're grinders. I will look in their mouths and know that they're grinding, and they don't think they're grinding. Those patients do very well with appliance therapy.
Okay, good. So you have, what do you call it? Like a multidisciplinary approach to headache pain, the cranial or oral facial pain? What do you call it? Because you have I guess a lot of different things you're doing.
You know, there's a lot of different modalities. You have to get the diagnosis of why someone has a headache. Once you get a diagnosis, you can treat. Unfortunately, the way medicine is these days, people don't have the time to do a diagnosis. The patient doesn't want the time, and a lot of times, unfortunately, the doctor doesn't have the time, so they end up with a medicine, and that medicine just masks. But to get to the cause and the root of a problem takes time from both the doctor and the patient.
But you have it happen.
And we have it happen.
So
every day we're having it happen.
You say that there are people that are on medications for their headaches, and that you've been able to, with the help of their doctor, wean them off the medication.
Yes, because I work with the doctor.
Rare? Is that rare?
No, it's far from rare. We've had patients, because every patient that's referred to me from a headache doctor is usually, whether it's not from that headache doctor, but in their history,
a medical doctor. They're referring you people?
Yes. And most of these patients, minimum 6 meds all the time, 6, 10, 12 medicines. Working with their doctor, we have many people that are off their meds and headache-free.
Okay, good. We're out of time. I want to thank you for coming on the show. If somebody wants to know more about this, they just go to your website.
Yes.
Learn more there. Pleasure having you on the show.
Thanks.
Thanks so much. You've been watching The Wellness Hour. I'm Randy Alvarez. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.